put a fork in you, you're done. You may have had your doctor check your cervix and he said maybe your cervix is 1 or closed, thick and high. And you're thinking, how do I get this cervix to dilate to get this baby out of me? Today, I'm going to tell you some ways to let your cervix dilate faster, what you need to know about dilation, and how to get your cervix to dilate faster once you're actually in labor. So let's get going. And as a caveat, my last baby was 12 days overdue. So I 100% understand wanting to get your cervix to dilate. I'm just here to tell you there are some proven methods to do that, and those are the ones that we use in the hospital. So talk with your provider if you want to get an induction. If you're past 39 weeks, usually that's an option. But if you want to avoid that, that's what this video is for. And by the way, usually if you're worried about your dilation, you're in your 3rd trimester, and I have a whole 3rd trimester prep pack that I'm going to link to down below. It's super helpful, lots of checklists, things to watch for, stuff like that. Okay, so how does dilation work? Well, as a labor and delivery nurse, we're able to check your dilation. We go into the birth canal area and we feel for how open this is. This is the bottom of your uterus. It's called your cervix. And that's ultimately what we're checking. It's just the bottom of your uterus. It's part of your uterus. If you were to have a hysterectomy, a lot of times they remove it. It's just checking to see how much baby is bulging at the bottom to open this up. And by the way, this uterus is about, 4 centimeters. Got stretched out and I had to sew them back together. Yeah, feels familiar, honestly. So there you go. Now, there's a big difference between pain, which a lot of these things, side note, I have a whole video on if jumping jacks will put you into labor that we talk about this more, things that will cause pain, but actually won't push baby on the cervix and to help it open up. So you got to think the baby's head is in here and that is what is pushing down on the cervix to open it up, right? That is what pushes baby into the birth canal, is the uterus contracting down on the baby pushing on the cervix, and then descending into the birth canal. I like to think of it as a really tight sweater. When you're pulling it over your head, it starts to thin out and open up, and then eventually your head pops out. And that's the same thing with your cervix. When you are 10 centimeters, that ultimately means that the baby's head is out here like this, and the cervix has gone all behind their head. We can't feel it anymore. So what makes you dilate faster? The first one is to soften the cervix. So there are things that I recommend that can help soften the cervix. I actually have a whole video on it. Cliff notes, they include pumping, primrose oil, sexy time with your partner, and dates. All of those things need to be started a few weeks in advance. So if you're looking to do it tonight, a lot of times they might not do it. But as you can imagine, if this cervix at the end of your uterus is super hard, it's super thick, sometimes when we check it, they feel like really hard plastic. That's going to be harder to open up than if this feels like, a real nice soft cheese, like a brie. That's going to be easier to open up. So softening up your cervix helps it to dilate a little bit quicker. And again, if you're not looking to do it tonight, check out that video. Another thing that can help is to open up that pelvis. That's why I always recommend things like sexy hip circles, in addition to maybe helping to relax your pelvic floor, which you got to think your pelvic floor is like a bowl in here, right? There's a lot of muscles around here that help suspend your uterus and your bladder and your rectum and all those important things that go into your pelvis. But if all of those muscles are super tight, that can extend to your cervix as well. And it can also prevent the baby from descending. So when you're doing things that are outside of your norm, sexy hip circles, left to right lateral lunges, sometimes curb walking, that can help baby find their best way down into the cervix. And if the cervix is soft, it may help it to dilate. And finally, the good old fashioned one of contractions, just waiting for your uterus to decide, okay, it's time to get baby out. Remember, when you go into labor, 3 things have to agree. Your brain, it needs to say, okay, we're in a safe situation. We're ready to have this baby. Your uterus says, you know what, this baby's getting too big. We need to get it out before it's too big to have this baby. And then the actual baby sends out something that says, hey guys, I'm done. My lungs are good. We're ready to go. So all of those things have to agree. And that is what tells your uterus, yep, it's time to start contracting. Let's get this baby out of us. And ultimately, that thing, which we really do not have that much control over, is what pushes the baby into the birth canal and helps our cervix dilate. And I'm here to tell you, if you're falling into the trap of you can do something to put you into labor, Hillary totally fell into that trap too, but you can't. There really isn't all that much that you can do to put yourself into labor. So I wish that I had just kicked my feet up, ate some frozen yogurt, and watched some, I don't know, Little House on the Prairie, reruns of ER. I don't know. I don't know what I was watching back then, but I wish I would have watched more of it instead of worrying and freaking out that I could have made myself go into labor. Because in most cases, it really is not the case. So if you don't have control over it, how do you get your cervix to dilate faster? Well, there are proven methods that we use in the hospital. There's a Foley bulb induction where we manually open it up with a balloon. There's prostaglandins, things like Cervidil, Cytotec, same thing as misoprostol or Prostin gel. Those have been shown to soften your cervix and start up contractions. And then finally, Pitocin starts those contractions and really pushes baby into the birth canal. Those are the proven methods to get your cervix to dilate. So if you're in labor and you're thinking, now how do I get myself to dilate? I'm having the contractions, but my cervix is just not opening up as quickly as I wish it would. First off, again, you don't have control over that. The first 5 centimeters are often very slow compared to the last 5 centimeters. But there are a couple things that you can do. The first one is to relax. Your brain needs to know that you are in a safe place and in a safe situation to have this baby, and let the oxytocin that tells your uterus to contract to just flow among your body. I actually have a whole post on my website about helping oxytocin flow. I'm going to link that down below. And this is actually comes from a post on my website, and I'll link the full post about this down below as well. And the final one is to move. When you get into the hospital, it can feel very much like you need to lay in bed and let those monitors sit on you. And I'm here to tell you that there's a lot of flexibility. Even if you have to have wired monitors on you, I have a whole video on wired versus wireless monitoring where I go through some great ways to incorporate movement. Even if you have wired monitors, you can still move a lot in the labor and delivery room. So I'm going to link that post down below. But incorporating movement into your labor is the best way to help your cervix to dilate in addition to relaxing. So I think that's a great thing for partners to do. They know every half an hour they should be encouraging you to move. If you have an epidural, they can help your nurse move you. But if you don't have an epidural, they can just help you get up. They can help you, change positions and find ways that are more comfortable. Partners can be a good advantage in this, but they have to know what they're doing, which is why I recommend taking a birth class that gives them idea of what to do. I actually have a birth class that I recommend that's for couples. I'm going to link it down below. Now, you might not have known some of these ways to dilate faster, but I actually do have some lies about labor that a lot of you are believing. I'm going to link that video up above. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.